There's been remarkable progress in treatment for people living with HIV over the past 4 decades, and innovation will continue to drive this forward. But there are still inequalities in access. Partnerships to increase global access to medicines and vaccines are a priority of biopharmaceutical companies that IFPMA represent worldwide. I'm joined now by their Assistant Director General, Greg Perry. Good to have you with us.
Good morning.
There's a lot, as we just said, to celebrate over the last 40 years. What stands out for you?
Before we talk about the celebrations, I think we've also just got to acknowledge the over 36 million people who have died from HIV/AIDS from this epidemic. That has been globally, but indeed innovation has been critical from the start of the epidemic, which was a death sentence, and we had no treatments. We have got to the situation now through unprecedented medical innovation, people living normal lives where they have access to the treatments. So that has been something to celebrate. And that's been based on medical innovation. It's also been based on certain partnerships in working together with organizations that have been set up by the global community to ensure that you can have access to these treatments.
Looking forward, what's on the horizon for HIV treatment?
40 treatments have already been registered over that 4-decade period by the FDA. And now there are some 50 treatments, including new combinations, new methods of delivery that are in the pipeline. There's also research and development on a vaccine. The reason why we don't have a vaccine for HIV at the moment is not because of no intention by the industry or investment or wish. It's because it's an extremely complicated virus to deal with. It's very important that we can develop new formulations for children and new methods of delivery, particularly in what's called resource-limited settings. And one of the things that the industry was criticized, quite rightly, in the late 1990s, and it wasn't really doing much on the access side. That changed fundamentally after that, with industry being committed to access programs, working with organizations like the Global Fund, and also setting up voluntary licensing agreements, for example, either bilaterally or through the medicines patent pool.
Those remarkable successes in treatment now mean that in the UK, for example, people living with HIV can expect to live long lives. Now, that isn't the same across the world, is it?
Unfortunately not, no. And I think Africa is an example of a lion's share of that problem. Not everyone is having access to the treatments that are available. There is a number of reasons for that. One is to do with system management. The other to do is, and I think this is very important, is to do with stigma and to do with prejudice. There is, prejudice and stigma for men having sex with men. There is stigma and prejudice against migrant workers. There are high vulnerability rates for women, and especially young women. And just taking Africa, for example, we have a situation in which 60% of all known new cases of HIV are with women, and 6 out of 7 of adolescents, that's 15 to 19 are young women. And these things need to be addressed. Now, even in the UK, it has to be said that not everybody is getting the treatment. People do fall under the radar, particularly migrants. COVID had an impact on the way in which we were able to distribute our products, because it had impacts on the supply chain, and also in reach out to communities. Testing has fallen by 41%, for example, in the African continent, for HIV patients.
I mean, you've touched on quite a lot of the factors there, but I wonder if there are any more that might be behind those healthcare inequalities globally, and also the difficulty in access to drugs.
The difficulties, as I said, one is about management, and I think this is where it's vitally important that the Global Fund and all the other institutions that are working with the Global Fund are very well supported. Now, the United Kingdom has been one of the founders and one of the principal supporters of the Global Fund. And there's a replenishment next year in 2022. So it is important that the United Kingdom maintains its commitment for that replenishment and its commitment.
When it comes to patient care, what do you think industry can learn from community-driven support movements and also from social support when it comes to looking after people living with HIV?
Yeah, I'd like to say that the communities, that is people living with HIV, are absolutely fundamental in being able to advocate and, for example, be part of the whole structure of delivery, awareness, and dealing with issues. They're advocates. They put pressure on the government. They put pressure on industry. So they are key. And I believe that the future is working together in partnership with communities, NGOs, doctors on the ground, and governments to be able to move on from 40 years where we've seen progress to hopefully at one point we can recognize that there'll be a final case. We have a lot to do still.
Certainly a lofty ambition. Greg, Perry, thanks so much for your time.
Thank you.